My name is Josh McMullen. I am a community-based case manager here at Northern Nevada Hopes.
How does housing affect people's health?
I believe that housing affects people's health in a lot of different ways. One of the things about being housed is that you actually have a place to go. You have a place to put your things. You have a place for your food. You have a place to cook food. And so a lot of those things directly affect a person's health. And when we really, talk about it in those sense, or when we talk about it in terms of health, people that live on the streets are typically less healthy than people that have housing, and it's due to a lot of different factors. But I would say that being able to have your stuff, have food, be able to prepare food, and in all in one place is the most important thing, and I think that directly relates to health.
Does the location of where people are housed affect their health as well?
I believe that the location of where people are housed does directly affect their health. When we talk about some of the transitions that have been made, such as Section 8 housing and HUD housing, one of the things that I've recognized is people sometimes are going from neighborhoods that are less violent, closer to more easily accessed resources such as grocery stores, maybe drugstores, things like that. And they're having to move to other places that maybe only have convenience stores, liquor stores, and maybe they're a more violent neighborhood. I think those two things are really easy when we're talking about, directly affecting somebody's health in terms of location. Another point of contention, I think, also is how far do they have to go in order to access the resources that they need to be healthy. And so when we talk about, like, if somebody is living down the street from Hope's or another place where they're going to get their treatment, or if they live 10 miles away, that's a big difference in terms of their commute time and what they have to do to be able to get here. So when we look at that, that's another factor that directly would affect their health as well.
What sort of housing resources does Hopes offer the community?
Hopes offers 3 different types of housing resources for the community. My program, I'm working primarily with people that are homeless currently and are typically chronically homeless with a severe mental illness. I'm trying to move people into transitional housing, which at this point typically means motels, and then we build off of that and try and get them into more permanent housing, which could mean apartments, it could mean studio apartments, it could mean a lot of different things. We also have PC housing, and that is for any of our patients that are coming through and seeing a provider here, and if they need assistance with rent, or if they have a problem making their payment for their energy bill, things like that. That one's evaluated a little bit differently because we want to establish if a person is able to sustain what they have going on and maybe they just ran into an issue, or if it's not going to be sustainable long term, then we'll look at probably some other options for them, to be able to be self-sustaining, because that's the goal. The last type of housing that we do is for our ID patients, and that is typically through Ryan White Part B and HOPWA, and those are only for patients that are HIV positive or have AIDS, and there's three different programs within that, as far as I know. One is a long-term housing where they pay for, I think it's like 8 to 10 months worth of housing. There's another one that is short-term, like say somebody is just kind of on hard times and they need some assistance for a couple months. That would be one way to assist. And then there's also you know, they would help somebody get off of the streets and get into a place as well. So there is some transitional housing within the ID housing case managers as well.